All right, welcome back to Level the Playing Field. I'm Dr. Owusu-Akyaw. I'm going to talk to you about pain management today after the surgery. So please like and subscribe. We'll get into some details about how this affects patients and how this might even contribute to the opioid crisis or not. Continue to follow. Let's get into it. So surgery is a big deal. I mean, that's not a big statement. You all know that. And we expect you to have pain after surgery. That's how it goes, okay? Our goal is for that to be more healing pain as compared to the pain you had before surgery. But just the act of simply us going in and fixing what we fix is gonna cause pain. And so we have to be judicious about how we treat that pain after surgery. And if there's anything that the current opioid crisis has taught us, it's that being judicious is critical. Okay. There was a time when we thought that, we could use medications like opioids, narcotics, however you want to call them, right, indiscriminately if you were in pain, especially after a surgery. And we learned increasingly that's not true. Even if we're treating someone who very much needs pain control, like after a surgery, it's still possible for that person to become addicted. And that's from using the medication exactly the way it's supposed to be used. So we as doctors have to be very judicious about how we do things when it comes to that. And so one of the keys to ensuring that we're not over-prescribing these medications is using what's called a multimodal pain regimen. Multimodal pain regimen. And what that means is rather than using just one thing to treat your pain, we're gonna come at it from different angles, right? So we're not relying on just one type of medication. Now, let's go back to some basics about what different pain medicines are, all right? So opioids are medicines that are based on either derived from or synthetically similar to the opium plant, all right? That opium plant has a natural characteristic that when it's eaten, ingested, smoked, whatever, right? It hits the pain sensors inside your body and creates, lessens pain, creates euphoria, for some people creates, hallucinations, whatever. It does different things within your brain and it changes how things move, right? And one of the big effects is pain. So the opioid medications are medications that are either made from the opium plant, which is less common now, or they're synthetic or scientifically made to be similar to that plant, which is what most of them are. So examples of that are things like oxycodone, which can be also called roxicodone. Oxycodone can be paired with Tylenol in the same pill. And when that happens, that's called Percocet, right? There's Dilaudid, which is just another type of that medication. There's hydromorphone is the scientific generic name for Dilaudid, right? People talk about Norco, people talk about Vicodin. These are all just different types of this medication in the same family, okay? And so these medications can do a lot for pain, right? Because again, they go in and they modulate the way your body experiences pain. It goes to the sensors in your brain that feel pain and they kind of change how they interact and make it so you don't feel it as much, right? But they have a lot of side effects, right? The one you know about from watching the news is addiction, of course, you know that. So when used enough times, right, it becomes addicting, and what happens is your body becomes reliant on this medication almost to function properly. And that is the cause of the addiction. And that can happen to anyone who uses the medication for a prolonged period of time. Now, based on who you are, how susceptible you are to that is different, right? But any person who takes this medication has some risk for that. So that's something we gotta think about. But there's other side effects too, dangerous ones. So if taken enough, these opioid medication will actually make you stop breathing, all right? They'll actually affect the part of your brain that controls how you breathe and actually shut it down, all right? So that's a dangerous thing, of course. Other side effects are constipation. So these medications can actually slow down your GI system, your digestive system. It can, for some people, bring it to a complete halt, right? And so that can cause terrible constipation. I mean, constipation to the point some people have to have, interventions or surgeries or even procedures to get them unblocked right after taking this medication long enough. So constipation is another one. Some people will get itching, hives, dizziness, right? They'll feel like the room is spinning, kind of vertigo feelings. They'll get, breakout rashes around their body. So there's a lot of side effects to this. So as you might imagine, we want to limit the use of these opioid medications as much as we can. Don't get me wrong, they play a role after surgery. They play a role. Most surgeries most major surgeries, you're gonna see these prescriptions given, at least to some extent, but we wanna minimize that. So that takes me back to my multimodal pain regimen concept I spoke to you about. Again, we wanna tackle that pain from as many different directions as possible to minimize how much you use the opioid, or even make it so you don't need it at all. And that's been a big topic of study in orthopedic surgery for us, figuring out the best regimen to keep you as a patient needing as little opioid as possible. So what are different things that we can use as part of this multimodal regimen, different directions that we can take it in, right? All right, so let's take it back to, say, a knee surgery. Let's say you had a meniscus repair, right? Now, during surgery, at the time of surgery, maybe right after, a lot of times we'll do what's called a nerve block. So what is a nerve block? We're taking numbing medicine, like lidocaine, what the dentist gives you before they do their work, right? Where you feel numb. And we can actually take some of that medicine and we can put it around the nerves that give you feeling in your knee, right? And so the idea is to make it so you don't feel that knee. Now, you might say, well, you're going to sleep anyway for surgery. Why do we need to do that? Well, believe it or not, your body actually maintains memory of pain even when you're asleep for surgery. So it's important for us to try the best we can to try and decrease what you feel when you're asleep for surgery. So a lot of times before we even start surgery, we'll do these nerve blocks, or rather the anesthesiologist will do a nerve block around the area so that the feeling is decreased. And that nerve block will last for some time after surgery even. It can be 10, 12, even 24 hours depending on the situation, right? So we're trying to keep you from feeling pain from the very beginning. And as you probably imagine, right after you have a major surgery, that's when your pain is gonna be the worst. So having that nerve block in place so you don't feel that the very first bit of pain, is important. It's a great move. It helps you decrease how much you're gonna use opioid, decrease opioid utilization. That's key. Now, that's not a perfect situation, right? Nerve blocks work different for different people. For some people, they knock pain out completely. For some people, they just take the edge off. Frankly, for some people, they don't work at all. Everybody's different, right? But the ideal situation is that it works. It cuts back how much you need to use any other pain medicine. So that's one option. That's one part of our multimodal pain regimen, right? Another option, right? So some things that you are familiar with from day-to-day life actually can play a role in decreasing pain. So Tylenol, acetaminophen is the generic or scientific name for Tylenol, right? That can play a role for someone's pain control after surgery. Now we think of Tylenol just being some ho-hum little over-the-counter thing, right? You've taken it for headaches. That's not gonna help me with surgery pain. But believe it or not, Tylenol can actually play a pretty big role in decreasing pain. Now, like any medicine that has side effects, we don't want you taking it forever. That's not particularly good for your liver or your kidneys in some situations, right? But in limited doses, right, and if timed correctly, we can make it so that it takes some more edge off that pain. And every little edge we can take off of that pain, that's one less opioid pill you take, right? And we prevented you from taking one more. So we get Tylenol, even though it seems like basic, whatever day-to-day stuff, it can play a role. Next are things we call NSAIDs, non-steroidal anti-inflammatory drugs, NSAIDs. Now you don't know that name maybe, but that you've heard of the drugs. Advil, ibuprofen, Aleve, Voltaren, that's all that category of medicine, okay? Now, there are some surgeries we can't use that, and that depends on what you have, right? But when it's available to us, that's another strong way for us to keep the pain down. Now, with a lot of orthopedic surgeries, the pain that you feel is from the surgery, yes, but also from inflammation from your body having undergone surgery. Inflammation is the swelling, right? The feeling of warmth, the feeling like, for some people, like my knee's gonna explode, like it feels full, it feels too big, too full to move. That's inflammation. And that's frankly one of the biggest causes of pain after surgery, even more so than the actual fact that you got an incision or a cut. So in some surgeries, we can use those anti-inflammatories, those NSAID medications to decrease that pain, right? And that can actually be more effective than, again, those opioids, because we're addressing the thing that's making you hurt the most, rather than just making you feel different about the pain, which is what the opioid is doing. So those NSAIDs, again, have side effects. We can't have you taking it forever, right? It can have side effects on your stomach. For some people, it can cause stomach ulcers. For some people, it can cause kidney problems, right? Everybody's different, and that's something you have to talk to your doctor specifically about. However, that's oftentimes something that we'll use as part of our plan to manage that pain and keep you from using those opioid medications, all right? There are other medications that we can also use that can kind of keep your pain from feeling at its peak, right? So sometimes we'll use things like nerve pain medicines. There are some medicines that kind of, again, target the nerves so you don't feel pain as much. We talked about that in the sense of the nerve block, but those also can be taken in a pill form in some situations too. So these are all different examples of things we do. But something that people oftentimes forget and that seems kind of mundane or day to day is icing. All right, icing is actually a huge thing for a lot of orthopedic surgeries. And again, that's addressing that most common thing that we said causes pain after the surgery, which is inflammation. Ice is a key thing for keeping that inflammation and that swelling down, which ultimately decreases pain. So if we think about the different things that we can do, right, nerve blocks, different medications like anti-inflammatories, sometimes Tylenol, and icing. These are things that we can do to decrease the amount of opioid that's being used after surgery. And increasingly, we're trying to get away from taking those except for when, you absolutely need it. And as a bailout, kind of last resort pain medicine, they have a role. I don't want to demonize them and make it seem like they can't be used. They need to be used in some cases, but our goal is to use them as little as possible because of all those terrible side effects we talked about earlier. So I hope this gave some more background information about how pain control may go after surgery. Everybody's situation is different and you need to consult with your doctor based on how things are gonna go for you. We hope to see you next time. Please like and subscribe for more information about sports and orthopedic medicine.